Hey y'all, Summer Terry here, and tonight I'm with Dr. Sam Crosby, which he has been such a wealth of information on the EPM topic. This is, I don't know, our third or fourth live I think that we've done together.
At least.
Yeah, so he's been great at, being able to help spread the knowledge, being able to help answer questions. I'm going to go over a few ground rules before we get started tonight. So, again, this is an informational Facebook Live. We're not diagnosing, we're not giving treatment advice, we're not doing anything other than getting general information out there. So whenever you're posting your questions, please keep that in mind. And because we've had such an overwhelming response to this event, what we're going to do is I'm going to kind of let him take over, and we're going to go through what is EPM, where are we seeing it, kind of just our general information about it. Probably we're going to cover a lot of questions that have been asked or the questions that you're thinking about. I'll go over some of the rehab protocols, things that we do from that aspect of it, and then we're going to dive into any questions that we didn't get answered with our general information. So welcome everybody. Again, also too, if you can't stay for the whole live, you will be able to watch this anytime on the Superior Therapy page. A lot of people have, revisited our old lives that we've done, so some of that information is going to be stuff that maybe we've talked about previously. But welcome to all of our new followers and people that are tuning in. So without hesitation, I'm going to turn it over to Dr. Crosby.
Thank you. So basically we're here to talk about EPM, and everybody's interested in that subject. EPM, otherwise known as equine protozoal myeloencephalitis. Okay, basically the strict definition of that is a disease that is passed by mostly possums. Okay, and then you'll get a lot of people just call it the possum disease. That's not really correct, so we'll correct that here in a second. The Sarcocystis neurona and Neospora husei are the two main causative agents. And these are protozoan organisms. They are bugs. They're not bacteria. They're not a virus. They're an actual bug. They're microscopic, but they're still a bug. They're passed in feces of other animals, mostly possums. These protozoan organisms migrate after being ingested in the fecal matter that's usually in the hay or the feed. And they will hatch, and then they migrate throughout the body to get to the nervous tissue or muscular tissue. Depending on where they hit, most of the time they try to get into the nervous tissue. And when they get into the spinal cord, they'll make a home in there. Now the horse's immune system will hold them at bay for a while until there is some kind of stressor event. A stressor event could be high temperatures, could be low temperatures, could be a 3-day rodeo, could be any kind of thing like that. Vaccines can cause a stress event. Injecting joints can cause a stress event. So everybody's trying to lower these stress events and possibly not get EPM. Okay? So God bless you, but it's awful hard to lessen stress events. Stress events will happen. It's guesstimated that 85 to 95% of the animals in Oklahoma area are positive and have a positive titer for these protozoan organisms. And as such, basically they're sitting in there waiting for that stressor event to take place. So it's not like these animals are getting the disease. It's like they have had it. They've been carrying it, and then this stressor event sets it off. Once they take over, then they suppress the immune system even more. And a lot of times we'll find that while we're treating EPM, there is a concurrent infection going on at the same time with a different organism. A lot of times it'll be a tick fever, Lyme disease, etc., like that. So another lesser known fact is that there are two types of EPM. There is a muscular and there is a neurologic. And you could argue that I'm totally full of it, But when we say that, what we're saying is you can have a protozoal infestation of the muscle. That organism is Sarcocystis fayeri. Okay, there was a study done by the University of California at Davis by Dr. Monica Ailman about 5 or 6 years ago, and she came out and gave a paper at the AAP meeting in San Francisco. And basically in that paper she stated that yes, Sarcocystis fayeri, while previously thought not to cause clinical symptoms, actually does cause clinical symptoms. Interestingly enough, both of those organisms produce a neurotoxin, Sarcocystis fayeri and Sarcocystis neurona, and what they do is those make identical symptoms, whereby we get generalized hypersensitivity, we get horses acting spooky, they lose weight, they become unthrifty, they lose top line, they lose muscle, and they drop in performance levels, sometimes with no clue that anything's going on. So a good physical is absolutely necessary to pick this up. You can send off for a titer on Sarcocystis fayeri, but a lot of times we pick it up in a good physical exam by basically just what I said, a generalized hypersensitivity, acupuncture points, and then get a good history. And so basically what you're looking at, you could look at those, either one of those. The difference is one of them's neurologic and the other one has more of a muscle weakness or and a generalized hypersensitivity. So the muscular version is a lot easier to treat because we generally get through with just 1 month of treatment. A lot of people believe that you can treat the neurologic version in 30 days and you're done. I have to respectfully disagree on that. Most neurologic cases that we see require at least 3 months of treatment. I usually treat 3 months in a row, and I will switch treatments up where I'm using a different treatment each of the 3 months, or at least 2 of those 3 months I'll switch around. The treatments that are out there commercially available is Protozil and Marquis. Both of them are really good. Both of them are fairly expensive. I think Marquis is running around $1,500 for a month of treatment. Protozil is running around $900 for a month of treatment. Protozil is marketed as diclazuril pellets. It's marketed as a prevention and a really good deal. But it's a little bit high to be feeding all the time. There are ways around that. You can feed a little bit less and it works just as well. The company doesn't really want that out there because their studies indicate that it takes this much to do it. So they try not to put that out there, but you can do that. There are compounded treatments out there. I think that pretty soon those are coming to an end, like pretty soon by next month, because the FDA has new guidelines. GFI 256 is out there, and it states that if there is a commercial medication available, the veterinarian has to use the commercial medication and cannot compound a treatment. So that's going to cause a lot of changes in the treatment plans and whatnot. I think Protozil will probably be one of the more common treatments that will be used at this point. The difference in the two varieties of EPM, or the two protozoan infestations, if you will, is that the neurologic version is passed by possums, Sarcocystis neurona. They have implicated cats and sometimes, but I don't know that they've really got a good handle on that particular deal. However, Sarcocystis fayeri, the muscular version, is passed by everything that eats meat and defecates in the hayfield. And so probably 85 to 90% of the cases that you actually see out there will be Sarcocystis fayeri because it's passed by everything. When I say craps in the hayfield, I've had multiple instances where I think it's been proven. Like I had a farm that had 85 head of horses on it, and we didn't have any EPM that we had found. And then we switched hay companies, and all of a sudden, in less than a month, I've got probably 6 cases. So, everybody wants to say, well, how can I use hay that doesn't have it in it? Frankly, there's not really a whole lot of ways to avoid it. You know, I've wondered about steaming hay, but to be honest with you, I don't think that there's a deadlock solution to get away from it. You're going to be exposed to it.
And that was one of the questions that was asked, was about, you know, would the hay steamers control, you know, is there a benefit to that?
It's a viable option. I think a person could try it. I don't know for sure. You would think that it would work. I haven't done an actual study where I could sit down and say, oh yeah, this horse, and I don't really know how you would, I don't know how you go about doing that study, to tell you the truth, until you would know. You'd probably just have to do it to your horses, and then if your horses never got EPM, then you would have to say, well, there, I proved it. But
right.
I don't think that that's actually a viable scientific study. But so that is a good question, but there's really not a way around it. You're going to get exposed to it. It's when I first started seeing the muscular version more around 2010. We were in a drought, and then we started catching more and more of these things, and we started looking, trying to figure out, you know. And we wrote down where this horse came from. We wrote down what they were feeding, you know. And at that time, we didn't see any in the Texas Panhandle. We saw very few south of the Oklahoma line, just a few from Texas. We saw a few in Kansas. Missouri was always had a bunch. So Missouri and Oklahoma were like ground zero. And then
And what year was that?
That was around 2010.
Okay.
That's when we started seeing it.
Okay.
Now, as it's gone, I get a lot of phone calls, mainly thanks to these blogs and stuff that we do. I get a lot of phone calls from people from all over, East Coast, West Coast, North. I even had one call from England. Mm-hmm. So basically, you talk to these people, and you can start expanding your map from 2000 out. You started seeing it from further out. You know, at one point we saw 2 horses one day in the Texas Panhandle around Canadian, and they were feeding hay from Chickasha, Oklahoma, and that was quite a while back. Mm-hmm. But now I see it pretty much any state in the union that's been through the clinic. They pretty much we've seen it in those horses, and I get calls daily, California and the East Coast, and we talk to people. The hardest thing to talk to them, you know, they're really wanting help. Everybody wants to know, you know, what can I do?
Right.
And all you can do is all I can do is guide them. You know, legally I can't do a whole lot more than that. Mm-hmm. So all I can do is try to guide them, and I can tell them what they need to ask for, what they need to look for, and hopefully they can get some help. You know, I get a lot of people that come to the clinic specifically for this problem,
right.
And we treat a lot of horses, and we see a lot of it. And right now, like you asked me when you came in, right now I'm seeing a pretty good portion. Sometimes I see 2, 3 a day.
So do you feel like that has to do with, I mean, in Oklahoma, you know, like I know we're starting to head towards that spring and summer. So one, it's starting to get hot. Of course, last 3 days I've worked in a hoodie, so we haven't hit the heat stroke yet. But do you think it has more to do with the temperature change, or do you think that it has more to do with the starch in the grass that's coming up in our pastures?
The pollen.
And the pollen.
I think it's the pollens. I think it's the allergies. I think all of that combines, and we're starting to see that spike. There's always a spike in the spring. Mm-hmm. We had a spike this winter right after that really cold snap that we had down here. Right after that big cold snap where it got down really, really cold for about a week, we saw a bunch of them right after that. And then we got a little lull, and then this week we've seen a pretty good number already.
So again, it circles back to the stressors.
That's the stressor. It always comes to a stressor. And it's like you talked about, you know, basically your gut health is the basis of your immune system. And we never, ever get our gut health just right. We're constantly striving for that.
Right.
Right? And if you can keep your gut health pretty good, and you feed probiotics, and you feed good feed, and your horse looks really good, then he's going to do a little bit better. If this horse is a little bit thin, generally speaking, and a little bit unthrifty, he's going to have a harder go. And what you'll see when you get these, when the EPM takes over, you know, you'll see a horse that'll get more sarcoid tumors. Those are immune related. They'll get more sarcoid tumors. They'll get more respiratory conditions. And like I said, concurrently, they'll usually have you can find one with a tick fever here and there. I actually isolated tularemia out of a horse one time, which is actually known as rabbit fever. And it's a reportable disease. And the state called me and was like, how in the heck did you find rabbit fever in a horse? I was like, a lucky guess, I guess. But you find all kinds of different things that are related to this. It has so many facets and it comes from so many ways. And it's easy to try to blame everything on EPM, but that's not really the answer either. You gotta walk down the middle somewhere. You're going to find a lot of horses with EPM, and generally what we do is we say, okay, we're going to treat this horse for EPM, and then we'll have you come back in 3 weeks to 30 days, and then we're going to go back over and we're going to do a recheck, see how our EPM symptoms look, and then, as I always tell everybody, it leaves a present. You've got to recheck them because it's going to leave you a present. There's going to be a stifle, there's going to be a hock that's sore, there's going to be ulcers, there's going to be something that comes up after you treat them with this. And this is where you come in. This is the rehab portion. So many people just want to throw a treatment at them and then just go right back to running. I mean, the biggest question I get is, can I run him next weekend? And I'm like, well, you're missing the bigger picture.
And I don't think that they understand the importance of the stabilizing muscle,
Right.
which, we can get into later on. I want to circle back to talking about like our stressors on our digestive system. So we've talked about external stressors, like as far as our weather changes and things like that. Like, I'd like for you to touch on how does pain, especially chronic pain, say we have a horse that has back pain or stifle pain, tense muscle, what effect does that have on our digestive system? And how does that pair in? Because we see a lot of horses that eventually end up diagnosed with kissing spine that we call them our EPM frequent flyers,
Right.
if you will, where it's like, okay, this horse isn't doing right, like we've treated him, he's been treated 3 times this year for EPM, and you just keep seeing these reoccurrences. And I think one thing that people don't take into consideration is like, again, hunting that root cause. And so it's like, how much of effect does that chronic daily pain have on the digestive tract and the body's ability to have and maintain the function of the immune system?
It's huge. It's not only the pain, but a chronically nervous horse be the same way. You can't keep their gut straight. You can do all you can do, and you're still gonna. If you just drop your guard for a minute, it'll take over. And I'll tell you, you're talking about internal stressors. An interesting case was that I worked on was an EPM horse that I treated. He got better, relapsed. We treated him again, and then he relapsed, and then he got to a point where nothing I did seemed to matter. Even if I kept him on treatment every day, I could keep him. But if I just stopped treatment for just a little while, this horse would come right back with a raging case of apparent EPM. And reaching for some kind of ideas on that deal, turns out we take soy out of his diet. And when we took soy out of his diet, he straightens right up. And there is a lady out there, and I'm sorry, I would love to give her a shout out. I don't remember her name, but she screams about the soy and the diet for EPM all the time.
Nutritionist?
I believe so.
I know Martha Faraday is one. I know her name escapes me, but A&J Equine. I know she's another. There's a lot out there.
That is the deal. When we took that horse off of soy, he straightened right up, and we didn't have that problem anymore.
So it was just keeping that inflammation in the gut.
Yeah. And so, I mean, allergies are a big part of this deal too. It's like you said, the pollen and whatnot. Any kind of allergy is a stressor as well.
Mm-hmm.
And so we do a lot of allergy testing as well, trying to eliminate that as a problem.
Yeah, because anything that's taxing on the immune system. So let's kind of go over some, like what are some common things that you see? Like, when you're doing exam, I know some vets, a tail exam is one of the common ones that we've seen for a long time, like testing for their neurologic. But, when you're looking at that quality of horse, what are you looking for?
Okay, so in my particular instance, I do an exam, a physical exam. It's closely related to an acupuncture exam. It's something, and like a lot of people, I take things that other people do and I make them my own over a year's time. And so my exam basically is a very hands-on exam. I'm looking for generalized hypersensitivity. I'll follow over the top line. I go down over back of the horse, I go down the neck, I'll come down the shoulder. And what I see on these horses is, like I said, a generalized hypersensitivity. But then there are 4 acupuncture points that are pretty much pathognomonic. I mean, if you find them and they're lit up, then you more than likely have this. Rarely do they. I've had horses had it that have had EPM really bad. And if they get it really bad, they'll get a dead-sided appearance to them. You'll go over them physically trying to find them. They won't show you anything. But when they're that bad, generally they're neurologic, and you catch it on that part of your exam. So I start with a good physical going over the top line. I use basically I use a needle cover. I used to use this Mont Blanc pen until I rubbed the top off of it, and I had to repair it, and it cost me $250. So at one point,
that's a lot of exams, right
Yeah.
there. If you have rubbed off a pen, that is a lot of exams.
I rubbed the top right off of that sucker. Well, when they made me pay for that, I thought, and at that point, everybody was like, "Have you got your pen? Can you look at my horse?" So I graduated to a needle cover after that because that's a lot cheaper. So I take a needle cover, and I use a blunt needle cover, nothing sharp or anything, and I'll press with a consistent deal, and I'll go over all my points. I go over the bottom line, the top line, then I check my EPM points, and basically you can verify at that point. You'll start your first exam is usually a little bit of a throwaway, and then we'll take them out, we'll trot them, we'll do circles, and then we'll go up straight up and down the hallway on a hard surface, and then I go back over them. Now my second exam, that's when I usually pick up more of my points. That's when everybody starts showing you. And sometimes you'll have to do some flexions and whatnot, and then they start showing you all their points. Mm-hmm. Once I start getting my points and I got a hypersensitivity, then I'll break into a neurology exam. And what we'll do is we'll go straight down the hall, holding their head out of position. Because when you hold their head out of position, this horse has gotten used to traveling the way he is. If you take his head out of the position that he's normally accustomed to, he'll get a little wobbly. We'll back him up. We do tight circles. We'll go over them looking for sensory deprivation on their skin. I usually use the tail pull for last. I find it to be helpful mildly in some instances, but most of the time everybody is on the tail pull. They try to be Hercules, they jerk them way over, that horse just flies over and they're like, oh my God, he's neurologic, That really doesn't work that way.
Right. And to kind of add in, for those of us that follow along that with a therapy rehab, what he's checking with those exams is proprioception. So we know that, EPM really targets those proprioceptive nerves, and kind of like you're talking about, they get used to traveling crooked or traveling a certain way, and then you try to change the way they travel. That nerve brain connectivity is not there, and it's not sharp enough to make an adjustment quickly. So then therefore you find the weakness.
And
that's a lot of what we do as rehab therapists in a lot of our assessments as well. Right. Is we're targeting more muscle weakness, where if I have something that's a true lameness, I'm going to say, hey, we need to refer this horse to a vet.
Yeah, and I found that if you cause them to fall out and you make them use those proprioceptive stuff, that's when they really start firing, and then everything starts firing. And then when you do that exam over and over again, it's like you're connecting the dots. Of course, I'm following some meridians, so you'll fire those up, and the more you go over them, the more hot they get. And then some of them get so agitated they just try to kick you,
yes,
bite you, whatever they can do to get away from you. Just stop.
And also to add into some of our followers, like where we're talking about now, again, I know Dr. Crosby has his own formula, but one of the books that I'm constantly posting about on here, and I'll repost some of this stuff, tomorrow for our new followers, but Dr. Kane's book, that his acupuncture book has a lot of really, really great formulas and things to add in. Even if you're not somebody, that does acupuncture, you can also use those formulas and use acupressure, use a cold laser. There are ways to stimulate those points besides actually needling them. Now, many times it might be more effective to actually find an acupuncturist that can needle those areas, but you can definitely stimulate any of the meridians, any of the acupuncture points by pressure, again, red light, laser, those type of things as well.
Dr. Kane was a fascinating guy. I was lucky enough to meet him I think it was back in the 80s.
I wish I would
No,
have.
it was in the 90s. It was in the 90s. He was towards the end there. But he was a super good guy. And I got to talk to him, and I bought my book straight from him. And it was very fascinating. One of my favorite Dr. Kane stories was how he came back from China, and he was at the racetrack trying to get him to use him. And he sat at the, what they call the gap. And he'd watch horses, and when they'd come by, if they were sore or something, he'd follow them to the barn, and he'd tell them, hey, let me work on your horse, and I'll get him to win for you. And he's hoping to get business.
Right.
And he told me, he said, I came to one conclusion. And I said, what was that? He said, cheap horses run better when they're sore. And I laughed. And we laughed for a while. I thought, my God. And then he goes, and it's true. He said, look at it. He said, a cheap horse doesn't want to run anyway because he's just a cheap horse. He doesn't want to run at all. So, but if he hurts a little bit, when he goes up to those gates, he knows it's going to hurt, and then his adrenaline takes off. And then when they open up the gates, he runs like crazy because his adrenaline's all pumped up. He said, but a really good horse is going to run through that anyway. So that was his. I thought it was hysterical.
Well, and I actually think that brings up a good educational point where we talk about, our posterior or our stabilizing muscle. If our stabilizing muscle is not strong and developed, the only thing you have left to use is adrenaline. Mm-hmm. And, those are the horses that flood out or they bleed or, tie up afterward because they've just exerted everything basing that on adrenaline, where when you have a horse that's in good condition and, everything is working right, then we have our stabilizing muscle, not depleting our oxygen levels quite as quickly as that surge of adrenaline does. Right. So your good horses have that. They save that surge of adrenaline for right there at the end when they need it in a pinch, and they're using their body condition to do most of the work.
Yeah, we say good horse, bad horse. I mean, don't mean to offend anybody. Basically,
right? We're
just talking about breeding.
Well prepared horses. Yeah. We're going to go that well prepared and in good condition horses.
Pretty much. But I thought that was a really good story.
No, I think that's great.
I learned a lot from Dr. Kane. I also learned a lot from Dominic Jeannot, who was kind of his partner, and he was a French osteopath.
Yes, and this is another book that I carry with me. This one, both of those books, when I do my individual sessions, they go in the library that I can use for visual aids. But yes, tell us a little bit about him, because that's a book that I talk about quite often. He's the one that, to add in, he's the one that really changed my opinion on the negative angles in the hooves. Mm-hmm. It's like when we were seeing these back horses and we'd get them and they can't pick their feet up and they just, nothing functions on them. Yes, we're really taught to look at the hooves and things, but like he changed my entire perspective on adding that little bit of a wedge pad and causing that entire shift in a positive way throughout the body. Yeah, so his book was very life-changing for my practice and how we do therapy.
Yeah, he had some great ideas. He was fascinating to watch, and some of the things he did were incredible. He was a great big guy. He's probably 6'4", and he could reach over the horse and grab him by the short rib over there, and he'd twist him like that. Mm-hmm. And then he did a mixture of chiropractic, osteopathy, whatnot. But he would do things and work on things that I didn't think were problems. And I think that's an interesting. You are a combination, no matter who you are, what you do. You're a combination of the people that taught you something, mm-hmm. right? And all of these mentors that come in together, they all teach you something. You try to take whatever they have, make it yours, and if it works for you, you use it and you move on and you just keep. But the thing is you got to constantly keep bringing things in. You got to be receptive. You got to be open-minded.
We call it building our therapist toolbox.
Yeah.
Which I guess you could have building a veterinary toolbox as well. But
yeah, keep building, that's for sure.
Yeah, absolutely, because there's no one fix for anything, and absolutely. About the time you think you have something figured out, you get a case in there that it's like, okay, back to the drawing board because this doesn't work. Everything I thought does not work.
And that has been the case with EPM. I never started out to be the guy that treats EPM. That wasn't what I started out to do. It just EPM was in my way mm-hmm. from getting this horse to be right. And so as we kept working towards this deal, we get there it is. It's in the way again. And so then you consciously got to a point where you didn't want to be the guy when he came in, everything's EPM, right?
Right.
But I couldn't not call it if you see it.
Because you hear that a lot. Oh, these vets, when they don't know what the problem is, it's EPN.
Right.
That's just the throwaway answer to everything.
And to be honest with you, when I got out of school, I was young and arrogant, and I thought EPM was a garbage can diagnosis. Called a garbage can diagnosis because when they don't know what it is, that's what they call it. But another mentor, Dr. John Madigan from UC Davis, went on a meeting with him, a 7-day meeting, and he basically, there was only 8 veterinarians there, and he talked about whatever you wanted to talk about. So I asked him about EPM. When I came home from that trip, I diagnosed a couple of horses that I've been working on already with EPM, and from that point on, I was actively working, trying to find a treatment that worked, and constantly trying to get better at diagnosing. And then when 2010 hit, and all of these horses started showing up, you're like, oh my gosh, what's going on?
Right.
And then, and that's kind of funny because Dr. Madigan showed up again during that deal. And that was the basis of that study that they did at the AAP meeting. Mm-hmm.
Well, and could you talk a little bit about doing the muscle biopsies that you did, like your participation in that story?
Sure.
Because didn't you present on that as well?
I didn't actually present. I was given credit for part of the deal, but that's just because I did all the samples and everything.
Mm-hmm.
I didn't do any scientific. Dr. Ailman did almost everything, and she's a board-certified neurologist there at UC Davis. But I ran into her and Dr. Madigan at the airport in Denver, and over Wolfgang Puck's pizza, I presented my case for what I see, because I go to every meeting, and it's just the same frustration that these people are finding out there. It's like, what are you seeing with EPM? What's being done with EPM? Nothing's ever being done with EPM. Nobody has done anything. It's the same deal.
Right.
And so when I saw him, I was like, hey, I got to talk to you. I got this going on. I'm seeing this symptoms. I'm seeing this. And then Dr. Edelman got all excited, and she says, it's sarcocystis feri. And I'm like, oh, finally, we're getting somewhere, And that's when they set up a study through the office. And what we did is, now this was tough because everybody that has a barrel horse wants to run them next week, and they don't really want you to do a muscle biopsy, right? So, and the muscle biopsies are all up on the top line. So you have to present this in a certain way. So no, did I do a muscle biopsy on every horse that came through? No. But I presented them and I said, look, I would like to do a muscle biopsy. Now, I did my muscle biopsies in the epaxial muscles, and then I did some over the croup muscles, which is both of the muscles that atrophy the most, the top line.
And is there a reason that you see most of the atrophy there? Is it the softness of that muscle? Is it just because they're a superficial muscle?
I honestly believe that those are the easiest muscles to see atrophy in. Those bugs are everywhere.
Right.
It's just that those muscles are so big and so developed that that's where we see things when they go away.
Right. And that's also where a lot of our power and our stability,
Right.
like even when we go to like human exercise programs, it's, you got to strengthen your core, strengthen your glutes. It's the same thing with our horses. I may say it 10 times a day. We got to strengthen the core and strengthen the glutes.
Yeah.
So
that's where I don't think there's more bugs there. I think we see that loss more.
Okay.
Right?
No.
So yeah, we did muscle biopsies consisting of a punch biopsy. I'd sew those shut, and then we'd do blood samples on each one.
And I know there were several out of our facility that participated in that as well.
Yeah, I think we got 30 or 45 head, something like that, and got a lot of positives and a lot of bugs in our muscle samples. And
so that was your part. How many biopsies went into the study?
I want to say that at least 30 of them went.
Okay.
I don't remember the exact number. They have it on that talk, but I don't remember exactly. But it was a good number. It wasn't enough to be super significant, but it was enough that you could sure see what was going on. And interesting deal about this feri bug, the most common muscle for it to be encysted in is the tongue.
And we see a lot of chokes. We see a lot of horses that I think get misrepresented as, having a hyoid issue.
Oh yeah.
And yeah, we noticed that the choking is a big thing.
Yeah.
And I also think as the tongue swells, they don't create as much saliva as they should to take the food down into the stomach, and so it'd be like us trying to be dehydrated, and then you eat crackers and you have nothing to wash it down
It's not
with.
working as well.
Mm-hmm.
None of that. The whole apparatus is affected. So yeah, that's a really interesting tidbit of information. I mean, there's all these little tidbits of information that you pull up from your books and from your studies and whatnot. Just like in the neurologic form, I think 70% of the horses present more in the right side than they do the left side. Go figure. I don't know what's up with that. But
so I have a theory on that. A lot of body workers and, people talk about like, oh, we're pulling all these horses crooked because, we mount horses from the left side. So we're constantly pulling them, off of that diagonal. But we found it even when we went up and worked in Indiana for the Amish, and we were working on buggy horses that are not broke to ride. So, there's no anything a human is doing to pull that horse crooked. But what I have found, just through body work and massage, is when we start to get gas release and when we get in there and work on that digestive tract on that right side, it would make sense that there's more inflammation on that side, just because we have more digestive system.
That's absolutely true.
And, like talking about the asymmetrical gait where we have these horses that travel crooked and they don't drive up under them with that right hind. Usually I'm getting those horses before it becomes a stifle lameness. A lot of times when you get that gas release out of that gut and you get that gut area to simmer down, the horse starts to travel straighter.
Oh, that very well could.
So again, maybe we're all still circling back around to the gut here.
It is.
But, everything sits in there in, such a nice package. There's not a lot of room for excess inflammation.
Were you ever around Troy Brandenburg?
I was. I
Okay,
had an opportunity to learn from Troy.
Troy was very interesting to me, and I especially loved the deal he did where he would release tension in the abdomen. Basically, a horse that was in pain for a long time, he'd do a complete body down, and then he'd push that horse up. And this guy probably weighed, 98 pounds? Maybe.
Troy's a little guy.
Yeah. And so he'd get up underneath that horse, and he'd push, and he'd pull, and he'd take his hand and run that. And ostensibly said he was taking all the tension that was in the gut and moving it to the back, and then he'd take it down the leg and release it down by the hop. And I've done some of that, and I think there's a lot to it, and it kind of hooks in. I mean, this is kind of an aha moment. You're sitting here saying that, and you're absolutely right. The cecum, pelvic flexor, all that stuff's laying on that right side, and again, you're coming right back to the gut.
Well, and again, there are people that go to the ER all the time with gas and colon pain, and they feel it in their back.
Yeah.
And, it's one of those things, it's a laughing matter afterwards where you go, well, yeah, I went to the ER for gas, but I really thought I was dying. And, it's like, you don't realize how painful that is until you have that bloating pressing on those nerves,
right.
And a lot of times, again, in people, it presents as back pain. But yeah, no, Troy, and another thing that Troy talked about too was the amount, and I hope I don't butcher this if he happens to be watching, but he talked about, the way that the stomach moves when these horses are running, where it's like, we don't want a bunch of excess in those intestines because they're coming up and slapping against the ribs, so it's like, it doesn't mean we don't want to feed our horse for 12 hours before we're going to compete, because we know that they need some forage going through that digestive tract. But when you have the people that feed really heavy substance diets, then you have a lot that's still in there being digested, and you take that horse and explode with speed, those intestines can come up and be right in there in that diaphragm lung field. Another example for us would be, you go eat Mexican food or whatever, and an inflammatory type of food, you feel that in your diaphragm, because as that inflammation comes through there, and it can have an effect on how quality air comes through the body, getting that nice deep breath.
Yeah. Now all these little things that we're talking about with the gut, I mean, my God, you see it every day. And I've said this on one of our previous blogs when I went to the ozone meeting to see what they were doing, and they had a human doctor there talking about how Roundup or
pesticide.
I can't remember. Basically, was ubiquitous in our environment at this point, and he felt like we were all poisoned. And basically, if he combined it with gluten, he said that you could see the gut open up. And basically you're looking at leaky gut syndrome. So it's instead of keeping all of that stuff in and running it out, it's letting it through, and our bodies are full of toxins. And I mean, immediately you're like, that's what's going on with the leaky gut we see in the horses. And of course, then you've tried all the products for leaky guts.
That was going to be my next thing. It's like, okay, so we can't put our horses in a giant hamster ball. Like, they can't live in a glass house. They have to go out in this environment.
Sure.
For the most part, we're looking to compete on these horses. So it's like, what do we do? Because you can spend a fortune in supplements hoping something works. Like, we don't want one to have to stay on pharmaceutical treatment forever. Like, right. So that brings us to the, universal debate. Like, what is our solution here?
That's exactly where we're at. We're fighting. You just keep coming back in a circle. I haven't come to a point where I can say, magically, if you do this, you're not going to get this stuff. It just doesn't exist. It's not a perfect world.
And I think there's a lot of different root causes. Again, circling back to maybe our root cause is the diet. Maybe the root cause is a stressor like improper shoeing or stifle pain, back pain. That chronic pain that's constantly there.
So where you end up is you end up using medications as preventions, and you end up having to do it once every 6 months, and in some horses' case, you're going to have to do it every 3 months because their immune system just can't do it.
Mm-hmm. And so basically, like with our medications, it's getting rid of the infected, the protozoa that's present at the time that you're treating through a life cycle of that protozoa, correct?
Right. So I mean, there's not an answer where you can feed it every day and you're going to keep it away, right?
Right.
You can try, but what we have found is if we treat, say, every 3 months or every 6 months, even do a partial treatment every 3 months or every, like I said, some horses, immune-wise, we're going to have to do it every 3 months. Right. Other horses would just say, every 6 months, let's do a partial treatment. In our instance, sometimes we say a 2-week deal. And then in a lot of instances, too, if you're going to, say, the Ruby Buckle or something, next month, then maybe you ought to run a 2-week treatment through that horse so he doesn't magically pop up with it right when you get there.
There was a thread that came up on Facebook months ago that was like kind of blew up in a negative way, where somebody was asking, what treatment do people suggest for cell prepping?
Yeah.
And, there was a bunch of people in there, I can't believe that you would treat, like you would just treat one, because, but there again, if you've got a 2 or 3-year-old that maybe is just started, barely has any rights on it, and you take them to a loud environment like a sale, the stressors there are enormous, even for a trained horse.
Well, and also what we just said, Protozil is marketed as a prophylactic treatment. Mm-hmm. It's a prevention. So we're not doing anything bad. If you're going to do that, you're doing a prophylactic treatment. You can't blow up and say, I can't believe you just treat this horse. When we just said that 85 to 95% of the horses in Oklahoma are positive if you're on a titer on them.
And that's where I think the education is important because, in my opinion, that person wasn't off base asking what they were asking. They were trying to prevent somebody from purchasing that horse, and maybe there was a little bit of gut issue there, and then the horse changes ownership and goes through the stressors of adapting to a new environment, and they get a month down the road with this brand new horse they've paid for, and it's like, now we're having an EPM flare.
Well, and I think the people are saying, well, you're hiding the EPM. That's not what we're talking about. What we're talking about is a horse that is not showing any symptoms. Mm-hmm. But again, we said that thing hides in the body until a stressor brings it out, and a sale is a stressor.
Absolutely.
So I don't see anything wrong with it. Now, I'm completely against somebody having a neurologic horse who's going to treat it and put it in a sale and not tell anybody.
that's a whole different.
That's a completely different situation.
Yes, that's a whole different subject.
Yeah, I mean, so you're walking that line. I'll do exams on these horses, and I can't, like I said before, you don't want to talk about treatment. Everybody's offended about everything. What we're talking about here is what we see, what happens. We're talking about symptoms. We're talking about what can I do to keep this from affecting me.
Right.
And basically...
And do what's best for the horse.
Do what's best for the horse.
The whole reason we're doing these things is to improve the quality of life of these horses.
Yeah, that's exactly.
So I want to circle back around to the ozone. You brought that up. I know that's something that you do as well. So for people that are not familiar with ozone and the process, because you went through O3 vets. Is
that's correct? Yeah. I went to one of their conventions in Salt Lake City. I found them to be interesting, and I took some of their stuff again and then made it my own. And I probably don't do enough of it. I do some, but I don't push it enough, and I need to push it more. I've had some pretty good success with some of the stuff, absolutely. Ozone, I mean, most bacteria, most harmful bugs, most harmful viruses don't do well in a high oxygen environment. And so basically using ozone, which is O3 instead of O2, it is unstable, and therefore it breaks down and you can get more O2 in an environment.
So you're basically oxygenizing the bloodstream, oxygenizing the body, which is going to help the body to repair itself.
I've had wounds that I've injected ozone into. I've had, I've had some horses that are ill, and I do a treatment that combines blue light and ozone, and basically resets the immune system. And I've had good success with that as well. So I'm a believer in the ozone deal.
Yeah,
absolutely.
So, let's see, what have we not covered with it? We went over some. Did we get really into kind of our symptom, like, sometimes we call it the ain't doing right disease, where it's your poor performance, that type of thing. Let's kind of circle back to that.
Yeah, I mean that's probably the most common presentation. Although you will get a lot of horses that come in and they look like $1 million, and yet they have every they've got the symptoms. Okay, but 90% of the time you get a horse walks in and you're like, as soon as he walks in, you're oh my gosh, okay, I think that one's going to have it. I mean, my assistant Keith, everybody knows Keith.
We love Keith.
Yeah, Keith's a hell of a horseman. I mean, the guy is a horseman through and through. He remembers every horse that comes in. A lot of times he'll be standing there holding the horse, and he said, "This one's got it," and he'll say it before I ever put my hands on it. But it's you get them come in, they'll have a poor hair coat, they'll be thin, they'll be kind of gutted, and they'll be jumpy, and they will be. Keith always goes, he's seeing dead people.
That's what we've said that before, the seeing into another plane of existence.
Yeah.
Yes.
He whispers that to me sometimes. So those are things that you'll see a lot. Like I said, those are easy to see when they bring them in there. You're like, oh, I got this one before I ever got my hands on it, right? But then you go ahead and put your hands on it, go through your whole deal, and you're like, okay, I'm right on this one.
Right.
But then I've had horses come up to me and I can't prove it. I can't prove that he's got it. I got no neurologic symptoms. I got no points or anything.
We had one that we worked together on that I know we brought this horse back over to you 3 times, and I'm like, look, this horse won't pick up the back legs and is starting to get mean. It's starting to be a danger, and that's not this horse's personality.
And so you classify those things. I think I had this talk with somebody today. If you're gonna have 3 things that are gonna cause this type of deal, you're gonna have ovary, ulcers, or EPM. There's one of the clients today came in. They said this horse ran up the fence. They said he's got a chip. And I said, well, the chip's not going to make him run up the fence very often.
Right.
So it's going to be something else, and it was EPM. So, and that's what we talk about. There's only 3 things that will really have that. That's going to be ulcers, EPM, or
that complete change of demeanor.
Right. That change of demeanor that gets me. And so it's and that's why I always do the recheck when I treat. So if I treat them, I want to recheck them 3 weeks to 30 days. My pet peeve is when I treat one, and then I see that person 6 months to a year later, and they say, that's crap you didn't work at all. And I never saw the horse afterwards. And it was because we got the EPM under control, but he had ulcers after that. If we had gone ahead and got him with the ulcers and found whatever problem when we had him, it's not a 1-step deal, it's a 2 or 3-step deal. And then your muscle atrophy, and then your probiotics, you got to jump back in there and add stuff in there, and then you got to get him working again, get him moving, because then your psoas muscles are getting sore, and you got to go through that deal. And so it's never a 1-step process. It's not. It's not. I just treat it and then you go and he's going to be 100%.
Well, and one thing like we find, in the rehabbing part of it is you peel away those layers.
Yeah.
And like I've heard you say it before. You have to see what you're left with. What surprises does it leave you? What presents are left over?
Right.
And yeah, like, I mean, I think that's a huge part of it. And I think, like, kind of to jump into the rehab part of things, again, circling back to our stabilizing muscle, like, if we don't have that, we don't have our horse.
Right.
And, one of the kind of analogies that I use to teach about stabilizing muscle is I use the Fast and Furious movies, because I figure everybody's seen 1 or 10 of them.
Yeah.
And, when we go back to Vin Diesel's character, he's constantly telling Brian's character, you never had me, you never had your car. And that's where, Brian always goes to his NOS, which would be our representative of our anaerobic muscle or our fast twitch muscle, which depletes the oxygen in the body really quick, and you have to fuel that body on adrenaline. Well, that's going to run out in a pretty short spurt, where, Vin Diesel's character, he has trust in the car. Our car is our stabilizing muscle, our foundation of fitness that puts our horse together. And so if you have a lot better trust in your foundation of fitness, you're not going to have to switch into that fast twitch or muscle that's going to deplete everything.
Yep.
We have to have that foundation, and I think that's something that gets missed. But, like, okay, I'm going to ask you as a question as a veterinarian. Like, I also, on the flip side, like, we enjoyed getting horses while they were still on treatment.
Sure.
We like to get them into the rehab then, because I have something on there that is helping control my protozoa and control my inflammation, so that I can start this horse at a walk with very simple stabilizing drills. So, I wanted to get them straight from your office if that was an option. But then you have other owners that they're like, okay, well, they said just turn him out for 5 or 6 months. And then they completely lose all that conditioning on the horse.
Right.
And I mean, they've proven through ultrasound that 4 days of being on stall rest doing nothing, they can already detect muscle atrophy. And that's in humans and horses. So we can relate to that. Like, if you've ever had the flu and you've had to lay on the couch for a week, when you start back in your daily routine, it's a little hard till you get back in the swing of things. So I feel like there's a disconnect there between the therapists that work like me versus sometimes what the protocol is coming from their veterinarian, where the last thing I want is a horse to go stand and do nothing for 6 months, because even a healthy horse, that takes me longer to build that stabilizing muscle back when they've done nothing than to stay in some, work to build those postural muscles back up.
Well, you're exactly right. I mean, a disappointing thing to me is how we as veterinarians generally rely on the medication, basically without any knowledge of how to bring them back or push them forward. Basically, we go, well, we're going to give him 30 days of this, he's going to be fine. And that's not the case.
And to jump into another topic, that's something I see with injecting. I have the owner that comes in and they go, oh, we injected hocks, he should be fine. Well, okay, how long has he been compensating for those hocks? Like, and then they come back and they go, oh, that vet didn't know what he was doing because this didn't work. Well, no, you didn't rehab anything afterwards. What was the root cause and the reason we had to inject the hocks? Usually it's going to be muscle weakness, or overbuilding, either, overbuilding or weak areas that cause the strain on those joints in the first place. By the time it gets to you, yes, it's worked its way to a lameness, but, it's being able to understand the need for correct fitness to prevent seeing you. Yeah. I love hanging out with you, but I'd rather not have to see you for that.
Oh, believe me, I hear that every day. Hope I don't see you next week.
Right, and so I feel like there's a disconnect somewhere in the information on that. Mm-hmm. And I also feel like, as a whole, we're very Western medicine minded, whether it be in human medicine or animal medicine, where overseas there's more of a study on your biomechanics and how horses move and how their hoof patterns affect their posture.
It takes a different person to dig into that. I mean, you get so many people that come out of vet school and they never get any better, or they never look any deeper than they already have. And I think it goes back to what we're talking about, being open-minded. Mm-hmm. And you'll get a lot of, you'll find guys that they're like artists, They're constantly digging for more information, trying to put stuff together.
Mm-hmm. Building that toolbox.
Always building. And I got to admire guys like that. They just continually just keep moving forward. And I really like talking to some people like that. When you meet those are your guys I refer to as your mentors. You know, you're constantly learning something from them.
Right.
And just sitting at a kitchen table, I've got a mentor, Dr. Moyer, who was 16 years at the head of the New Bolton Center in Pennsylvania, and 23 years the head of the Texas A&M, and now he's 80 years old and retired in Billings, Montana. And every year I go elk hunting with him. And to sit across the table from this guy and just talk to him, I mean, you're sitting over just soaking up. He worked on Secretariat, you know, and he's done everything. And you sit there and you talk to him, and I mean, the things he says, you know, he'll come up with stuff like, you know, I pulled the inside nail on this shoe. Well, why'd you do that? And then when he tells you, you're like, oh my God, I never thought of that.
Right.
You know, that's fantastic stuff.
And,
that's good stuff.
You know, and it's one of those things too, like, it's hard to be great at everything,
Mm-hmm.
you know, where it's like, I feel like a lot of people have sought your information on the EPM. Like, you know, you've been one of those people that's really become your study. And not to say that you don't do a lot of lameness work and general vet work, but, you know, I think sometimes it's trying to find people that are willing to consider, you know, okay, this owner is not crazy. This owner is not being dramatic. When they say this horse is not acting normal, we have to take that into consideration.
Just somebody to listen to you and tell you, yeah, I've seen that.
Yeah.
And this is how we treat it.
So before I get into any questions here, because I'm gonna start kind of rolling through the questions. I want you to talk a little bit. I know this is branching out, but I want you to talk a little bit about your vets program, and I want you to talk about what you do for to help the college students, and kind of, I want to touch on that before we dive into our questions, because I think what you do to give back, like people don't understand the fact that you're here at 8 p.m. at night, and I know you've got to run a clinic tomorrow, and you're willing to sit here and help people answer questions and help spread this information, and I think that's great. And I think what you're doing for the college kids is great too.
Well, the VETS program is Veterinarians Encouraging Teaching. Basically, you can find it under, it's got a website.
I'll post that tomorrow. I'll post the website.
VetsForStudentsNetwork.net, I think it is. Anyway, it's a group of us. We have a board, and Dr. Brian Carroll here in Oklahoma City, Dr. Carly Turner at Lazy E, Laurel Hazard Klotz, she's a drug rep here in Oklahoma City, Dr. Stites over in Salisaw, and we've experienced a huge deal of growth since the COVID. We actually started in 2018, and we started with OSU. Basically, we'd take vet students out from the veterinary school and take them down, and we would provide the horses and stuff for them to learn on. We've got wet labs from everything from teaching horsemanship, just general horsemanship, putting a twitch on, putting a halter on, lunging. And I've had vet students come up to me and thank me because they were in a clinic and somebody asked them to lunge one, and we had actually taught them. In fact, it's probably you that taught them. And so we got that all the way up to going to surgery and doing, we had a colic surgery one at Pine Ridge Equine in Tulsa this week. Mm-hmm. And then we'll have smaller groups. I had a group of 3 young men from OSU come down, and we did a little wet lab last Sunday ourselves there at my father's place. And like I said, we go through, and we've had tremendous interest from the veterinary clinics around, and we've had tremendous interest from the students. And now we've spread. I've got students interested in Missouri. I've got students at OSU. We've got students that we talk to at Texas Tech. We've got students we talk to at Texas A&M. And now TEVA, Texas Equine Veterinary Association, has stepped up, and they're doing tremendous stuff with the students. So this summer, the summer symposium at TEVA in Fort Worth, VET is administrating the student wet labs during this deal, and there are going to be tons of students there. TEVA is stepped out and really has some great student programs.
So if these students are in vet school and in college, why is there a need for this outside education?
Well, this is practical experience, okay? What we're doing is practical experience. We teach them to pass a tube and stuff like that. Okay, people are under the impression that the kids that go to school are learning practical things. Basically, vet school is a lot like medical school or anything else. You're learning all the things you need to know for a foundation, and you have to teach yourself. You have to go out and do internships and residencies and whatnot to gain the skills. And if you weren't a agriculture person before you went to OSU and you wanted to be a horse person, you got 4 years to learn all that you and I have learned about horses over our lifetime.
A lot of it by trial and error as well.
Exactly. And so then we try to supply them with that practical knowledge. We're not trying to supplant the veterinary school by any means. We're just basically adding on to what they're, and we're able to add on and say, okay, here we can pass tubes, here we can do lameness exams. We've had that. We've had podiatry wet labs. We've had radiograph wet labs.
So it's basically preparing them so they don't, because I feel like that would be really hard to graduate and then you start your residency at, say a large surgery clinic like Oak Ridge and you really haven't gotten anything hands-on. That would be extremely intimidating.
That's exactly right. They need mentors. They need people. And the greatest thing is I have all these veterinarians out here that are working and they're grouchy and they're bitter towards the younger crowd. We don't understand each other, etc. And then I'll talk to them. I'll be like, hey, come up to this wet lab and help us teach this still. We were doing dentistry this week. You can come up and teach dentistry. Mm-hmm. And they're like, I don't want to go up there. I don't want to do that. And then they do it. And what they find is this is a group of committed veterinary students that are horribly interested in what they're doing.
Right.
And you can't quit. When you start doing a dentistry wet lab and we have all the equipment out there, you're going to be out there till dark or we run out of horses because those kids are not going to quit. They're just going to keep on going. They love it. And that's a very gratifying thing. Now, once every year we have a symposium at the Heritage Cell facility in Oklahoma City, and we put the veterinary clinics in the booths, the farm and ranch booths, and then we have several really good speakers usually, and then we let the students out and they go out and talk to various clinics. They'll be nationwide, but mostly in Texas, Oklahoma, the surrounding area, mm-hmm. and they actually get to meet the veterinarians.
That's awesome. That's got to be a great experience.
And then they get the chance to, I can get an internship or an externship, And so it was at that symposium that I found out that I've passed that line and I'm now the old guy. Because one of the speakers, a veterinarian that's a prominent professor at one of the vet schools, was speaking. And she told me, I used to come down here and work for you at the Heritage Place when I was a student. And I was like, oh my gosh. That just took the wind out of my sails. I'm like, God, I'm old.
I don't think so. You're only as old as you feel.
Yeah, I hope so. But I'm glad you gave me a chance to talk about the VET program. It's a heck of a deal. It's grown leaps and bounds in the last 2 years. This TIVA deal this summer is fantastic. A lot of students, and we're turning students on this year. I went to a boutique meeting at College Station, Texas A&M, and they had a mixer, and there was 3 young lady vets that had just graduated at this mixer. They were sitting next to me, and all 3 of them had come through our wet labs, and they were all 3 equine veterinarians in around the Houston area, and it was so gratifying.
Awesome.
If we always said if we got 1 student, we did good, and we're obviously we've done more than that. So, mm-hmm. And I get to meet people constantly. And there's still a lot of good students out there, a lot of good kids, a lot of fun. It's very gratifying. J.C. Ross, who's worked mm-hmm. for me for years, is now graduating. I can't hardly believe that. Going to work on her own. She's been here at the clinic doing an externship this week, and been so fun. It's hard to let them go and work on people's horses. It's like, will you let her work on them? And they're like, yeah, oh, cool, get after it.
That's awesome.
She treated a colic yesterday, and I sat there and helped her through it.
Right. So I want to touch on one more topic before we get to our questions, because, again, I'm all about, forming partnerships, working with veterinarians, without veterinarian backing, us as therapists, we have to have that veterinarian backing, one, for legality purposes, but 2, have somebody to bounce ideas off of and collaborate with. And so, I'm all about trying to break that negative stigma. It's like you see so much on social media where people are mad at their vets, they're criticizing, I feel like this is an industry that we need to protect and respect.
Right.
And, we talked a little bit earlier about the suicide rate in the industry, and I feel like that's a very relevant topic to touch on for just a minute, because I know you have a lot of frustrated owners, and do you have any advice on to your new vets that are starting out, or to your owners, how veterinarians need to be treated? I mean, we're all humans, and I mean, errors sometimes get made. There's a lot of things, but I feel like this is a profession where you lead with your heart and your soul, because it's a lot of long hours, and none of us are getting rich doing what we do.
It definitely
But I would like to talk just a few minutes on that.
That is it's a subject that hits deep home, because I lost my best friend, Dr. Stone from Lazy. He committed suicide in 2019. It's very, very troubling that people are going to that. I don't know that there's one thing that anybody can do. Sure, you're always going to have frustrated owners,
Right.
and I think a big part of it is that people just don't know how to cope with people anymore. I mean, the communication we've lost due to the social media and all that, they just don't know how to cope with hardship. People are going to get mad, and unfortunately, when you're a young veterinarian and you screw up, people hold you accountable and act like you're a criminal or something because you screwed up. And when I screw up, they go, "Oh, that's just old dog," and that's backwards.
Right.
That's completely backwards. They ought to be forgiven on these kids more, and be holding me to a higher standard, because I should know better. But I mean, we talk about this all the time now. I mean, every talk with vet students is about boundaries and stuff like that. So they're all wanting to draw boundaries, and I'm like, you just can't draw boundaries all the time in veterinary medicine, because, like you said, you lead with your heart. It's an empathy deal. Your clients are family. If you're truly your clients. I actually quit vetting for a while. You remember that? I stopped for a while, and one of the hardest things I ever did, because these people are like family to me. I mean, and so I
think there were a lot of us that were beating down the door demanding that you come back.
Well, and the thing is I never really completely quit, because I couldn't. I mean, and then as soon as I got a chance, I'm like, I'm out of here. I'm going back there. That's way more fun. But when you put your heart and soul and you put yourself out there, you're going to have those times when you get bitter, and you're going to have to work through that. And suicide's never the answer, of course. And I mean, and sure, suicide's not the answer. You can't hold yourself as a failure. You have to look at failures more as a learning experience.
Right.
You're going to fail, and sometimes it's heartbreaking. I had probably 3 or 4 cases in my 30 years of being a veterinarian that could constantly haunt me. Why didn't I do that? Why didn't I see that? And there's an answer,
But I think those are the ones that drive you forward.
They drive you forward, and
and I mean, I've had cases like that, but I've also had horses in my personal life.
Yeah.
I feel like there's always that story behind what drives us to, the passion part of the industry. Like, okay, this is what I have to go and be able to help others.
Exactly.
Because of this one horse that I couldn't.
Yeah, you got to pay this deal forward, and it's a shame that you do this your whole life, and then when you're physically unable to do it anymore, then you finally figured it out, pretty much. I mean, even now, like we had a case that come back and bit me in the butt this week, and I missed it, and it was a foal, which I'm not very good at foals. I tell everybody, don't bring your reproduction stuff to me. I suck at that. But it was a foal, and then afterwards I was like, gosh, dang it, I should have never missed that. That was something you should have seen.
But there again, I feel like people, they're so desperate. Everything is so expensive. It's like teaching them, like, okay, have a little bit of grace.
Yeah.
That's you're human, and just have respect for your veterinarians.
That's what we're talking about, those boundaries, and I have trouble with boundaries. I'm like, I guess I've got boundaries. They're really close.
Okay, let's jump into some of these questions. Some of these are going to be on the rehab. Like, I'm not going to spend a ton of time talking about rehab stuff, because if you go to any of our video playlist, I have a ton of free videos on there that I've done a ton of posts. We'll start kind of resharing some of our old content up That way we don't lengthen this out where everybody's here all night on the rehab topic, because that's a topic we talk about frequently on our page. So again, like our first question here is talking about muscular horses, the muscular version, waiting. Do you recommend they wait till the end of treatment to start exercise, or do you recommend them?
I usually give the muscular, if I deem it to be muscular EPM, I'll usually say, hey, let's give him a week for the medicine to kick in. By a week to 10 days, you're going to see some difference in him, okay? But you always preface that with the fact of, okay, are you watching this? If you're watching this horse, if you have an inkling that this horse is going to stumble or possibly hurt you, do not ride this horse.
Right.
But if you're pretty comfortable with him and you're doing work, it's better for, in my, and I'm sure your estimation too, it's better if you're getting back to work. I like to give them that first week just to get them through the muscle soreness and all that stuff.
Right.
And then once they're past that, let's get back to work. Let's get to doing stuff.
Right.
Whether you're going to do rehab or if you're just riding.
Mm-hmm. Another question here was talking about like different therapy options, like red light therapy. I have not read anything from company manufacturers that deters from red light therapy, laser, low intensity PMF. There was some misinformation on post a few years ago, but it was on using your higher intensity, like PMF machines. So, what we have seen is, again, I'm looking to try to decrease inflammation. I'm trying to increase circulation. I'm trying to stimulate that immune system, all things that are going to help the medication work more effectively. So I would not deter away from any of those things unless my horse is telling me that. We've had some horses that we can't do PMF on because it's too stimulating, it's simply too much. And so if we can't back the intensity down to where the horse benefits from it, then we do leave that therapy off for a bit until we get everything more stabilized. So I think there's a lot of great therapy tools out there. That's where, one, knowing what the manufacturer of that equipment recommends, and two, having somebody that has an education in, EPM and everything that's going on within that horse's system. That's where having your practitioners that have education, having your therapists that have education, that's going to help you tremendously with choosing the right equipment for that situation, because every horse is an individual. But just in generalities, our therapy equipment, again, is designed to, reduce pain, increase circulation, decrease inflammation, and stimulate the immune system. All four of those things we're looking for as a, solution to heading towards our recovery. Let's see, going down through here. I don't think we talked about types of testing, ways to test.
Yeah. That question is, do the titers differentiate the different types of protozoa? Actually, no. The titers, now, yes and no. University of California, Davis does test for Fayeri, Sarcoidosis Fayeri. If you request it, they can do that. And also there is a private lab out of Florida, pathogens, however you pronounce that does a test for Fayeri. But most of the time they're looking, when they send in a titer, they're almost always looking for the neurona.
Okay. So would you recommend doing a spinal tap on a horse? What's the pro and cons of spinal tap? Because I know a lot of people that live in other states, those vets are requiring testing to, they don't do as much of the physical exam. It's okay, if we suspect this, we send in blood and then we wait.
So a spinal tap's usually going to run you around 500 or more. And it comes with some risk, right? But it is the only way to positively diagnose Sarcoidosis neurona, or EP.
So can they have Sarcoidosis Fayeri and pass the spinal tap?
Yes.
Okay.
Because there won't be anything in the spinal fluid. There's enough of a differentiation there. Sometimes those two will cross-react on the titer, and it'll cause problems. Other times they don't. It's a blood titers to me are frustrating because they're all over. I send in blood titers and the horse will be completely negative, and I know he's got it.
Mm-hmm.
And I go ahead and treat him, and then he blooms and he does really good when I treat him. So the blood titers are extremely frustrating for me. The spinal tap is the only absolutely true way to diagnose EPM, but it is expensive and there is some risk with it.
Mm-hmm. So,
but the insurance companies are going to love you if you do that. But the insurance companies will get along fine with a blood titer as well. If you get a positive blood titer, they'll be completely fine with that.
Okay.
And that's another thing that's come up with this GFI 256 we talked about earlier that the FDA has passed.
Mm-hmm.
The insurance companies are backing them on that deal, and they are going to deny your claim if you try to use a compounded treatment. If you have a horse that's insured and you treated him with a compounded treatment and then you try to collect mortality, they are saying that they are going to jump on board here and say, no, we're not going to pay that because you didn't use an approved treatment.
Well, that leads me to another question. I mean, I know every company is probably different, but if you treat for, say, ulcers or EPM, do you end up with an exclusion on that? Or with a recheck, do they lift the exclusion off on that horse?
No, they won't. If your horse had EPM and he was insured at one time, they will hit you with an exclusion on that, and you're probably not. They're not going to cover that horse if that's the cause of death. Now that's a generalized statement from a guy that's not in the insurance industry, but from what I've seen, that is how it works.
So that's something to keep in mind. Is there anywhere that people can read some of these studies, like, short of stuff that I'm, posting books all the time? Like, if I run across something that I deem educational, I definitely share it. But is there anywhere that the common horse owner can go and look at some of this research or what's being done? What can we do as horse owners to help the veterinary field
Well, to be
progress?
honest with you, I mean, all you can really do is get on Google and look through the different studies and see. It's hard to get onto the veterinary deals because a lot of them require you, like the AAP. You have to have an AAP license to get into their deals. And so you're not going to get some of those. But I mean, if you ask, I mean, hell, I'll get on there and find it for you and print it off if you want. I'm not very good at.
Oh goodness!
I
don't know that we want to offer that option.
Yeah,
to
I'd say if you call me,
hundreds and hundreds of people on the internet.
It may take me a while to find it. Okay, this lady says her horse presented with left laryngeal hemiplegia, which is not unusual because, again, like we said, some of the tongue is one of the biggest areas where they insist. Mm-hmm. But also the nerve, the recurrent laryngeal nerve that fires that arytenoid cartilage, basically goes all the way down to the heart, down the aorta, circles and comes back. So it's the longest nerve in the body, and that's why you get left laryngeal hemiplegia. There's a lot of nerve there to be damaged. Mm-hmm. And what people don't understand about that nerve on the left side is that a lot of times it's damaged by people missing the vein when they're veining a horse. Mm-hmm. That can damage that nerve as well. That's why most of the time you see a horse with left laryngeal hemiplegia. That's saying that the left arytenoid cartilage of the left flapper is paralyzed.
Mm-hmm. We had a horse that had surgery, and that was one that we worked together on, a donated horse. Right. And that was a horse. Like, I think that horse stayed in some state of constant stress. We were able to get weight on him. We'd almost had him to the point of being able to ride him, but he, as soon as we would take him off of medication, he would just go downhill instantly. But that horse had trouble with feed coming out of the nose, like where they had done that surgery, and water coming out of the nose. Like, we just didn't have the ideal situation, and I think it kept that horse in a state of constant stress that we weren't ever going to be able to control.
Yeah. This lady's asking what's the better gut supplements.
Mm-hmm.
I'm a big believer in combat boots. I like that one. I also like the Carbo Combo, and I like the Full Bucket. Mm-hmm. Probiotics. Those are my favorite probiotics. I'm sure there's others out there. Those are the ones that I've had experience with that I really like.
Now, I know you've also talked about, like, Succeed as well.
I use a lot of Succeed, especially in my treatment for the hind gut. Mm-hmm. Absolutely. I use a ton of it. It works great in the hind gut. I don't feel like it treats the ulcers all that great, but it does
does
tremendous
for the
work on the hind gut.
And so, like circling back to that, I know somebody asked that we'll get to that question later on. Do you always treat for ulcers while they're on EPM treatment, or do you do one and then the other?
I actually don't treat for ulcers while they're on it. It's a chicken before the egg deal. Okay, I feel like I'm probably going to have the ulcers anyway, and I'm constantly adding some kind of the medicine to whatever medicine you're using is a little bit irritable for the gut, so I usually treat them first and then treat the ulcers after the fact. That's part of it's kind of like the same deal with your rehab. Basically, once I get them treated, then I'm going to try to put them back together.
Right.
That's how I work.
And simple fact to add in, I don't know if this is something that you recommend or not, but what we found and where my information comes from is human studies,
right.
Is offsetting like our ulcer treatment, not giving another medication right behind it, because when you come in there and you're coating that stomach, you don't know what your absorption rate is of anything that you give directly after that.
That's another reason I don't do that.
So in my opinion, I always like to get my medications done. That way I know I have the highest rate of absorption possible, and then come back, if you recommend treatment, then come back and follow with that.
Because not every horse needs ulcer treatment afterwards. Some do, some don't. This guy, look at that. That's crazy. That horse had all of it. Sarcocyst neurona, N-Husei, Sarcocyst feri, polyneuritis, and toxoplasmosis.
Would you mind breaking down what I know we've covered neurona and feri, but would you mind kind of breaking down what each of those are?
Okay, so basically what he's saying is he pulled blood and he got a titer for neurona, got a titer for N-Husei. Neospora husei is one of the other culprits that cause EPM. And then Sarcocyst feri. So these are the two sarcocysts, the muscular Sarcocyst feri, the neurona, Sarcocyst neurona is the neurologic. And then he got a polyneuritis, P&E. Polyneuritis is a deal where the nerves are inflamed all over, basically from all the treatment that we're doing. So we get a kill on these bugs, and then that causes a bit of an inflammation in the nerve. And then we get into a deal where all the nerves are inflamed. And then toxoplasmosis is just basically, that's a red blood cell parasite, almost like a tick fever, if you will.
Okay.
So basically we got a concurrent infection going with toxoplasmosis. All of that indicates to you that exactly what we're talking about is the immune system is compromised at that point, completely
depleted.
Down.
Yes.
And then basically you've got to treat all of this before you can ever work on this horse's immune system and bring him back.
Absolutely.
And that polyneuritis is a booger bear.
Okay, so I know we talked about that.
There he was. He just said what I couldn't remember earlier. That's funny.
There's another one. Do you want me to read that one, or do you want to read?
I have a mare who injured her eye last year. Recently treated her for obvious EPM. Soon after, she developed uveitis and has lost most of the sight in that eye. She has also developed a cataract. One of the specialists we've seen said the EPM could have caused the uveitis flare. Have you seen this happen before? She appears to be over EPM. We're just trying to save her eye at this point. Any treatment suggestions? Well, that's a tough deal. The EPM, again, presses your immune system down. The thought is on the uveitis that possibly it's caused by leptospirosis, which is another bug that gets into the eye. Some of them are, some are recurrent. They call that recurrent equine uveitis. Unfortunately, once you get a cataract from the recurrent equine uveitis, sometimes there's so many changes to the eye that you can't actually do the cataract surgery. It's not a viable option. Mm-hmm. Sometimes it is. The treatment suggestions, basically, my goodness, if you've got the EPM over, treating recurrent equine uveitis is basically when it happens, you use Banamine, use some Dex, then you use some corticosteroid IOMs trying to get that inflammation down. Mm-hmm. But that it'll come back time and time again, and a lot of horses. I actually put one down this year that ended up having 2 cataracts from that.
Wow. Okay. Let's touch a little bit on the cranial nerves. I feel like that's one of the symptoms that presents a lot is like as we were talking, seeing into another plane of existence, or horses that are spooky. But like I also feel like things that we don't discuss so often is like head shyness, horses that don't want their ears touched, and I know you do chiropractic as well, and so how does that change how you assess that chiropractically when you have a horse that's mid flare?
A horse with mid flare, if you chiropract that horse, he'll be back sore within a couple of hours after you treat him. And chiropractic, it's so temporary as to be really not helpful at that point, unless his pole is completely out, and sometimes you can fix that and it'll help ease up the inflammation just a little bit. I found most of them are so inflamed that they have trouble coming back from that. So I don't really chiropract too many of them that are right in the middle of a mid flare. Chiropract a lot of them on my recheck.
And that's kind of where I'm at with body work.
Right.
It's like when we're rehabbing one, there's little things that we do along the way. We modify some stretches to the horse's tolerance and things like that. But I find that, like, as far as getting those good releases in the head, getting those good pole releases in the muscle, sometimes you're just poking the bear when they're in a really, mid flare, the mid height of being symptomatic. But when you start getting treatment in and start getting improvement there, then you can kind of go back to business as usual, as the horse will allow. Like, some of them, that's the last thing that I'm able to work on, is coming back to do that cranial work, because there's just so much inflammation in that trigeminal nerve. And I mean, you can look up trigeminal nerve pain in humans and get something that compares, because that's a terrible amount of pain, and it's a large nerve system in there. So it's very, very easy to overstimulate those horses.
Now you get this question here: effects from protozoal die-off after initial treatment. I mean, especially in the neurological one, you'll get a protozoal die-off. Absolutely. You'll get them coming your way, and you're thinking, oh yeah, I got it. And after about day 15 or so, they go take a dive down. Then they don't do very good until you start your second treatment, and then they'll start back up. The neurologic form is so frustrating, because, like I said, we'll treat for 3 months a lot of times. I'll move around and use different medications. But even after that, on some of the worst ones, we've treated for 3 months, and then we think we got them, they're doing great, and then we lay off for a month or two, and then bam, they have a relapse that quick. So you got to be on board after treating a neurologic horse. You got to be on board those relapses. You may have to go up 4 or 5 months, 6 months sometimes.
So question on the die-off periods. I know we've experienced colic, we've experienced them going off of feed. Like, sometimes you have to monitor those things. Horses being lethargic. You do. It is a little bit of an up and down roller coaster. So, as a customer, when do you pick up the phone and call the vet? Because I don't want to be calling you every night going, hey, he's laying down more than usual. But, like, as an owner, how do you monitor these things and decide, obviously call, like, we're going to call.
Right.
But it's like, how do you decide what is part of the process, and we have to just kind of wait through it, and when do we need to see the vet now?
Yeah.
Because some of these horses, the stress of hauling them, that's something we haven't even covered, is just standing in that trailer, especially if they don't live 30 minutes from their vet.
Sure. Yeah, and a lot of horses that come here with EPM have hauled maybe 2 to 4 hours sometimes.
Yeah.
And that stress, I read a deal today where a horse can lose 30 pounds on a 2-hour trailer trip. I mean, that's really interesting.
The AAP published a little fun fact thing that 3 hours on the trailer is equivalent to galloping a mile. So
doesn't surprise me at all. Yeah,
especially on Oklahoma roads.
Yeah, trying to stand up.
But when is an appropriate time to call?
Well, I mean, that's going to be it's different every time. I mean, when you jump in there, you're just like, as a horse person, you have to figure out when your horse is that stressed that you're going to need help. I mean, if he's laying down, he can't get up, sure, call. But if he's still up and he's eating a little bit and he's just stressed, well, no, I don't think it would be that necessary. But I mean, some of these horses do some crazy stuff, and you're watching them, and they'll even call me sometimes, and they'll say, this horse is doing this or this, and I'm like, oh my God, I never see that.
Right.
I'm not sure what to tell you about that. Maybe we better see that. So that happens a lot.
So 3 topics I want to cover. I want to cover sedation. Like, okay, if we have these EPM, a lot of people question, should we have their teeth done? Is it safe to sedate them? Is it safe to sedate them for injections? So I want to cover sedation. I want to cover vaccinations, and I want to cover deworming.
Okay.
So kind
Big
of
question right there. Okay, so first of all, I don't vaccinate while I'm treating.
okay.
Ever. I will vaccinate one right after I'm done treating if I feel like I've cleared it.
Okay.
Because I feel like that's the best time, is I just cleared it, especially with the muscular. Now, neurologic may be totally different. If he was very neurologic and we're really struggling, I may wait and I may just do one vaccine at a time or something, right?
Right.
Now, if I've got them feel like they're cleared and we're good, we're right after a treatment on the muscular deal or anything, we'll go ahead and worm them. And I don't have a problem doing that at all. Okay.
Are there any to avoid with just strictly with EPM horses? Are there?
Yeah, I a lot of times I'll get horses that come in, any wormers. No, not really. I mean, there's a lot of that going around where they say different things, but honestly, I couldn't throw stones at any one thing.
Okay.
Wormer, I like Quest. I like Quest Plus. I like Power Packs, like that. So no, I don't throw rocks at any one wormer. Absolutely not.
It's more about having that
The
immune system
Strangles
strong.
vaccine. If you were to throw rocks at a vaccine, Strangles vaccine is probably the toughest vaccine on a horse.
Okay.
So I'll probably lay off of it, especially the intranasal. I use the intranasal Strangles vaccine a lot, but I would probably hesitate to use it on one that I'm having trouble with on EPM.
Okay.
So yeah, and then the teeth, I'll always do the teeth. I'll always wait and do them right after I finish my treatment. So that's part of your research.
So sedation is okay.
Sedation's okay. Yeah, you're going to be fine, especially if you just treated him and you got him cleared.
Okay.
If he's doing good, then I'll go ahead and do it.
I know question on here on like herbal things. Like I know. I don't know if there's any supplements that you have found to be effective. I know that that's not really quite your area.
Well,
but
not, and
there's
that's
something you
more a
do
question for you, honestly. But the one that I use consistently and I recommend consistently is right after a neurologic course, when I treat a neurologic course. If I've done a course of 3 months of treatment, I'll tell them to get that super EPM dewormer because it seems to clear up lingering neurologic problems. I get a lot of horses that'll have a lingering neurologic issue, and we'll do 2 months of that super EPM dewormer, and it seems to let that go. I don't use it as a treatment, and I don't feel like it's effective really as a treatment, but it does have some benefits.
And that's kind of our recommendation too. Like I like it as a follow up.
Oh, absolutely.
And we've also personally had luck with Deanna Harrison's products as well.
Yeah. Oh yeah.
But my go to is usually coming to my vet first, whatever treatment you recommend, and then I start following up. Especially when I'm working with client horses, because we know that we want to get the most bang for our buck as well as the best healing. Now, another thing, like, what about? I know we've talked in past lives. What about the colloidal silver?
I use a lot of colloidal silver, and I'm a big fan of it. And colloidal silver has great effects that I can't even quantify them. To be honest with you, I mean, I've had horses that I've injected, I've chiropracted, and then I put them on colloidal silver, and out of the blue, I don't have to do it anymore. And I'm like, well, what did I just do? I don't really know. But colloidal silver has been a really good product for me. I give it along with the treatment, and it seems to help my treatment work better, work more effectively. And then we used to say, hey, we'll put you on this colloidal silver as a prevention. It's not a prevention, but it does help their health, their overall health. So basically, it does a little bit of prevention in that. Now, this is a tough question here, Kim Morgan. Hi, Kim. She's asking for a recommendation on every 3 to 6 month treatment, or would you rotate meds each treatment? No. I mean, if I picked one and it did a every 3 to 6 month deal. But right now, with what I was talking about, the FDA's recommendations and stuff, and the way this compounding situation is going to be, basically, I have to recommend diclazuril because you can
Which
You
is
can
your
use it-
Protozil, correct?
That's your Protozil pellets. And you don't have to do it every 3 or 6 months on that. You can do a lesser treatment and it'll last you longer as a prevention.
Mm-hmm.
So,
Now, if you were to leave a horse on that, is there any chance of resistance to that?
well, there's always going to be a chance of resistance. So, I mean, you could do a 2-week rotation of that and do it that way, or we can always figure out an alternative way to use it.
That's just having
But you
communication
gotta-
with your vet.
But you got to have communication with the vet, who's got to be communicating with the company and get, and they're not wanting to say, okay, we can use less of it, because that's not the way it was designed. However, you can.
Did we touch on that?
No, you don't. We didn't. But I mean, in Husei, Neosporic Husei is treated the exact same way as the Sarcocistus.
Okay. Whoops. I don't know why that just jumped. That just jumped way to the bottom, apparently.
There was a question there about using Dex with EPM. No, you really don't want to do that. You can use Dex because it's a short-acting cortisone, but usually stay away from cortisones when you're having a flare.
This is an interesting one. You think the measure of lactic acid at performance level to detect issues with heart, lungs, and muscles could be key in determining issues
That's a
with
LARC
EPM?
test person. I've got several people that I work for that do LARC tests. It's kind of an interesting deal. I haven't delved into it a tremendous amount, but it is interesting because they're using the lactic acid as well as different markers to see where the inflammation is, and sometimes it'll point you a way that you'll be like, oh, okay. I had one horse that this lady did the LARC test on, and then she came up and it sure enough had EPM. It indicated to her that yes, it did have EPM.
So that's a question here, I think, on,
Yeah, we talked about, yeah.
okay, so
This question's about blood tests, and they're inaccurate a lot of times, and they're very frustrating. And it's kind of hard if you're going to use a test to determine that your horse has EPM. You better go ahead and do
treatment.
the spinal tap.
Oh, okay.
If you're going to do if it's the
Neurologic.
The blood test, to me, I don't know, a good physical is beating the blood test right now. I've been very frustrated with the blood test.
One thing we didn't cover was steroids, like as far as injecting, causing flare-ups, what is it about injecting that causes that?
Well, steroids basically are anti-inflammatories. Everybody has a problem with steroids. They don't really understand steroids, okay? So there's 2 types of steroids. There's anabolic steroids, like equipoise, Winstrol, and that's what your guys are taking when they're doing this, and those are anabolic. Those are building steroids. They build up muscle line. The steroids that you're talking about are corticosteroids. Corticosteroids are steroids that we use for anti-inflammatories. Okay, so you've got several classes of those. You've got Dex, which works right now and has a lasting effect of almost 12 hours. You've got Vetalog, which starts in a few hours and might work for 3 days. And then you've got betamethasone, and then you go all the way up to Depo, which will take about 3 days to start working, and it'll work up to 3 weeks to 30 days. And sometimes they claim 40 days, but I think it's closer to 21 if you watch it. But all of those steroids, the corticosteroids, they do 2 things. One, they'll decrease your
Immune system.
they decrease your immune system, but they also decrease your adrenal glands. They depress your adrenal glands from producing a natural corticosteroid. Okay, so everybody, good Lord, everybody's on the bus about, oh my God, don't give corticosteroids, you're going to founder your horse, or don't do this, you're going to cause EPM. Okay, if you have a shot of Dex, it's only going to last about 12 hours. The fact, if it's going to stress the immune system, it's going to be very small. Depo would be worse in the fact that it works for a lot longer. So when we inject joints, generally we're using either Kenalog or Depo or one of those in conjunction with a hyaluronic acid. When you use a corticosteroid like Depo or something like that, you can cause a flare of EPM. Yes, you could. And that's one of the most common deals. You'll have a horse come in, he'll be sore. We talk about injecting the hocks or the stifle or whatever. We do that, and they come back in 4 to 5 days. Well, they don't come back 4 to 5 days. About 10 days out, they'll usually call and they go, okay, so for 4 or 5 days, this horse did wonderful. And now he's going downhill. And then you look at him, now he's got EPM. So yes, that can happen. Some people are staying away from corticosteroids, and that's wonderful. The only problem with that is any kind of regenerative medication, Noltrex or anything like that that's used for joint injections, the cost goes up on your injections quite a bit. And every one of them is different.
And then we have to pro and con, versus doing nothing, because again, chronic pain circles back to being hard on the gut, which brings us right back to where we started this topic. So again, like, I think just knowing your horse is, knowing your horse and having that great relationship with your vet. Are there any breeds that are more susceptible?
I haven't run across one, to be honest. I've seen it in every breed. Ponies, a lot less. I don't really get very many ponies again. I've had some, but a lot less.
I thought it was interesting. I had a lady that messaged me about a donkey getting it, and that was just something like, I had not really thought of.
I've seen that too, but less.
Mm-hmm.
So they are less susceptible. So in answer to your question, donkeys and ponies are a lot less.
Mm-hmm.
Draft horses, you'll see some. I've had some draft horses that have had it, and that's scary. But yeah, no, I haven't run. I thought saddlebred or standardbreds and Morgans were a little resistant for a while, but then after we got more into that breed, I had just as many of them as I did others. So no, I haven't run across any like that.
Okay. Kind of an equal opportunity player. Well, I think that kind of wraps us up. For those that are asking for Dr. Crosby's information, if it's fine with you, if they want to message the page, I know I kind of hand your number out, and I appreciate you being willing to help everybody. Again, he can't diagnose over the phone, but for information, you've been something that has, I think, helped a lot of people. One, understanding what their horses are going through, and two, have a little bit of hope. Like, I feel like sometimes our owners get so desperate, and they're just as stressed as the horses trying to figure out an answer, and sometimes just having somebody to be able to point them in the right direction is wonderful.
Yeah, and I'll give you my number.
Yes.
So
if you message the page, I will be happy to get you in contact with Dr. Crosby. Any final notes? I think we covered a lot. I appreciate it.
We covered a lot. There's one more on there asking about levamisole for polyneuritis, and yeah, that is a deal. A lot of people don't. We went by, I think. Thoughts on using levamisole. So the levamisole, a lot of people don't understand levamisole being in the treatment mix. They think levamisole actually treats EPM. It doesn't. It's actually an immune stimulant, and it's a kind of an all do-good type drug, basically. Levamisole makes the horse feel good, do good, and which is funny because levamisole was originally a pig wormer. And I don't think a lot of people realize that. But it's one of those drugs that has different abilities, like tetracycline. Mm-hmm. People use tetracycline to relax tendons, but it's actually an antibiotic.
So to circle back to the levamisole, would that be one of those cases where it's important to understand what the levamisole does, because you don't want to go out there a week later and your horse looks like he's feeling great and you decide to haul to the rodeo, and really the horse is feeling good because the levamisole is doing its job, not because we've completely cured the problem per se.
Right, and levamisole is being used in several different treatments, compounded treatments. Mm-hmm. The diclazuril, levamisole, vitamin E. Mm-hmm. They call the EPM shake, and that's the levamisole helps them feel better, while the diclazuril and the vitamin E are compensating the other way. Okay, so that's a big one. Then levamisole is used in what they call the pathogens treatment, origin, if you will, and a lot of people are using levamisole and decoquinine as a treatment. So there's a lot of treatments out there, but like I said, this new ruling by the FDA is going to really affect our compounding abilities. And so, you know, there are 2 good commercial treatments out there, and you know, I think we're going to have to explore them and just keep moving forward.
Well, I appreciate your time, and like I said, I'll always be thankful for how willing you are to help everybody.
Sure.
So we're going to wrap up, and this live will be posted. You'll be able to watch this forever. It will be on our video playlist with all of our other lives that we've done. So with that, we're going to conclude this evening. And like I said, thank you again. I really, really appreciate it, and I know the industry does as well. Thank you for everything you're doing.
I love it. Thank you.